Thank you so much, Jackie. I really appreciate it. So just to kind of go over steps forward in general before we dive more deeply into the clinical decision support module, I wanted to take a few minutes to talk about what steps forward is, how it came to be, and why we created this. So in 2012, our Executive Vice President, Dr. Madera, announced a new strategy for the AMA where we would have, as Dr. Bello mentioned, 3 different focus areas, one of which is accelerating change in medical education, one of which is improving health outcomes, and the third is professional satisfaction and practice sustainability, for which I work. And one of the things that we did in this brand new unit, in PS squared, as we call it, because that's a pretty long name, was do a study with RAND to really understand why physicians were struggling and why physicians were dissatisfied with their work. What we found from that study was a deep dissatisfaction with electronic health records and sort of how much of a burden they were placing on physicians, as well as a number of other factors that we felt we could start to address with some hands-on and easy-to-access education. And that's really how Steps Forward was born. This is a practice transformation series, and we really leveraged those findings and really dug pretty deeply into them to understand which ones we wanted to address first and how. So Steps Forward is an online platform launched in June 2015, and it offered at the time 16 modules, all offering continuing medical education credit. Most of them are about half a credit, some of them are a full credit, depending on the length. Now, as of August 31st, we have 43 modules, so that's a huge increase in only a year and a half, less than a year and a half. And it's become a very popular resource for physician and practice education, including, as I'm sure that some of my colleagues from ACR are going to talk about today, the Transforming Clinical Practice Initiative. This is a grant that, just to give you a little bit of background, a grant that is, its goal is to help 140,000 clinicians across the country transform their practices in meaningful ways with quality improvement initiatives, more efficiency, hands-on advice and input from quality improvement advisors, and networks such as ACR and AMA are providing technical assistance and help to these recruited physicians. And Steps Forward is one of our key educational offerings. So recently, as of August 31st, we have launched 8 new modules, and we now have 43 to offer. So in terms of what it offers, what it really offers in terms of categories, we have these 5 different categories, and the interesting thing about this is that they're all pretty broad, and as an example, technology and finance actually incorporates some information on value-based care, incorporates information on quality reporting. So if you dig deep into these different areas, in workflow and process, you'll find things like pre-visit planning, team documentation. In professional well-being, this really digs into physician burnout, resiliency, going into that 4th aim of the new quadruple aim, building on the IHI's triple aim of healthcare. And that's helping physicians be in a better environment of practice. And then, like I said, technology and finance is both issues of electronic health records as well as quality reporting with QCDRs. So that's one thing. And patient care, preventing type 2 diabetes, improving health outcomes for those with high blood pressure. And so all these can be found as Steps Forward. Each module only takes about 25 to 30 minutes to complete, including the CME credit. We designed these specifically so that busy physicians wouldn't feel like they were really drowning in more work to do CME. It's very easy to get to, and you can just click through all of the information and get the CME relatively quickly. And all of them are still free, open. There's no sign-in. That's another nice thing about it. In terms of how you can use Steps Forward, and this is for a clinician, this is for a staff person, this is for anyone really who wants to use this, especially a practice manager. First step, take the module. Take a dive into it, spend 25 minutes. It's very easy. Second step, work on integrating what you learn into your practice environment, and that could be by yourself at first or with a team, with a small team, almost in a pod or a pilot, and see what you learn. See what you learn about your own practice environment with your team. And then step 3, which is kind of what we're doing today, share that with what you've learned with your colleagues in your community. This is something that's incredibly important about Steps Forward and that we really have appreciated about it. It's very easy to share, and it's very easy to show as something that is a quick step forward in practice transformation. So these are our new Steps Forward modules. As you can tell, there's 8 of them, and then at the very bottom on the right, that's our quality reporting page. That's something that we're really kind of pushing right now because of all the interest in quality reporting, clinical data registries, and everything around the quality payment program and MACRA and everything like that. So these are all available to explore now, and 7 out of the 8 of these have CME attached to them. The quality reporting page doesn't because it's a resource page. And this is why we're all here today. This is the clinical decision support and diagnostic imaging modules. This is what you'll see when you actually go to the website. And as you can see down at the bottom, modules come with the module itself, but also downloadable tools. So these are things that you can take in your own practice and modify as how you'd like them to work for you. So it's not just something where you take it and say, well, this is a tool, it's set in stone, I can't do anything about it. These are usually Word documents, so you can modify them as to how they work best for you. And many of the modules actually also come with case studies to show how these different tools are being used in other practices. This is just another screenshot from the module. It talks about the 5 steps that improve imaging appropriateness, and then you can go into each step, click on a Q&A to go more deeply into each step. And as always, here's the link to the website, and we can explore that further at the stations after Dr. Bello does the second part of her presentation. I would like to ask Rasha to come up quickly just to talk a little bit about the partnership between AMA and Matter, because it's something we've had for a while. It's been a great partnership. So, Rasha?
Good morning, everyone. My name is Rasha Labranche. I am Product Development Manager at the AMA. I also manage our relationship between the AMA and Matter. So Matter was founded about 2 years ago, recognizing the need for a single place, separate place, for healthcare entrepreneurs to kind of come, commingle, and develop their products. The AMA recognized that this was a great opportunity to give physicians something that they've been wanting for a while, which was a seat at the table for all of the new technologies that were being developed, eventually for use by them. So what we've done is become a founding partner here at Matter. As Becca mentioned, it's been 1.5 years, a little bit, actually maybe 2 years now, great relationship. So much so that we actually have physical space here. It's the Interaction Studio. It's actually located around the corner to the left, where we actually seek to have those physical connections between physicians and entrepreneurs as they're developing those products. So we give feedback, we solicit feedback. If anybody has any questions about that, please let me know. But we're extremely excited to have you all here today. Thank you.